Definition. Venous thromboembolism is a disease that includes both deep venous thrombosis and pulmonary embolism. It is a common lethal disorder that affects hospitalized and non-hospitalized patients, recurs frequently, is often overlooked, and results in long-term complications including chronic thromboembolic pulmonary hypertension and the post-thrombotic syndrome. Etiology: venous thromboembolism results from a combination of hereditary and acquired risk factors, also known as thrombophilia or hypercoagulable states. In addition, vessel wall damage, venous stasis, and increased activation of clotting factors, first described by Rodolphe Virchow more than a century ago, remain the fundamental basis for our understanding of thrombosis. We have a video.
In the Western world, every 8 seconds a person develops a venous thromboembolic event. That's just over 4 million cases every year. In the European Union, over 500,000 people die every year of venous thromboembolism when a blood clot becomes a pulmonary embolism. If we take into account deaths due to pulmonary embolism in the United States, total mortality in the Western world rises to over 800,000 people per year. Other data from the United States show that venous thromboembolism is the immediate cause of death in up to 10% of all patients who die in hospitals. A European study published in 2007 shows that venous thromboembolism causes twice as many deaths as are caused by AIDS, breast cancer, prostate cancer, and road traffic accidents combined.
Pathophysiology and natural history. Venous thrombi, composed predominantly of red blood cells but also platelets and leukocytes bound together by fibrin, form in sites of vessel damage and areas of stagnant blood flow, such as the valve pockets of the deep veins of the calf or thick. Thrombi either remain in the peripheral veins, where they eventually undergo endogenous fibrinolysis and recanalization, or they embolize to the pulmonary arteries and cause PE. We have another video. Deep venous thrombosis. The lower extremities are the most common site for DVT, but other affected locations include the upper extremities and the mesenteric and pelvic veins, as well as the cerebral veins. A proximal lower extremity DVT, defined as occurring in the popliteal vein and above is linked to an estimated 50% risk of PE if not treated, while approximately 20% to 25% of cold vein thrombi propagate in the absence of treatment to involve the popliteal vein or above. Approximately 10% of all DVT cases involve the upper extremities. Complications are more common following DVT in the upper extremities than in the lower. Pulmonary embolism occurs in between 6% and 10% of cases following DVT in an upper extremity and in the 50% to 32% of cases following DVT in a lower extremity. Pulmonary emboli resulting from lower extremity DVT have the potential to lead to a number of physiologic changes due to obstruction of the pulmonary arteries. These include increased respiratory rate and hyperventilation, impairment of gas exchange due to impaired perfusion but not ventilation, interpulmonary shunting leading to hypoxemia and atelectasis, and vasoconstriction resulting from the release of inflammatory mediators, serotonin and thromboxane. In hemodynamically challenged patients, acutely elevated pulmonary vascular resistance results in decreased right ventricle output and hypotension. To work on the obstructing thrombus and maintain pulmonary perfusion, the right ventricle must generate systolic pressures in excess of 50 milligrams Hg and mean pulmonary artery pressures greater than 40. The normal right ventricle, however, is unable to generate these pressures, and right heart failure and cardiac collapse ensures. Additionally, elevated RV wall tension can lead to decreased right coronary artery flow and ischemia. Cardiopulmonary collapse from PE is more common in patients with coexisting coronary artery disease or underlying cardiopulmonary disease. Have another video.